Good morning, everybody, and thank you very much for joining this last SPHN webinar of the year, and actually the last one of the first funding phase of our national initiative. On this occasion, we have a special speaker today, Professor Dr. Urs Frey, who most of you probably already know. Urs is the medical director of the UKBB, the University Children's Hospital of Canton Basel-Stadt and Basel-Land. He's chief physician in Paediatrics, a member of the executive board, and as well a research group leader. And on top of these mandates, since 2 years, Urs chairs the SPHN National Steering Board. And despite of the many other important tasks he has, Urs invests a lot of time and efforts in the SPHN endeavor, for which, of course, we all are very grateful. So I'm happy to pass the word to you, Urs, now. Thank you very much for all the work you do for this initiative, and of course, also for taking the time for being with us today. Thank you, Urs.
Yeah, thank you very much, Katrin. Dear ladies and gentlemen, thank you very much for the opportunity to keep you updated on this really large project. And I'm actually really a clinician coming from the real world, and I try to also with this view introduce you a little bit into where we stand, where we would like to go, and I'm very happy to also address your questions. Let me start at the basis. I mean, 20 years ago, in clinical medicine, but also in science, we all believe that, one size fits all medicine is possible, that we can use for a certain disease entity, a group of drugs that can be used to treat patients, or a group of diagnostic measures to identify patients. But then, I guess in the last 20 years, we very clearly realized that even within a diagnosis, we have subgroups, strata of patients, clusters of patients who may actually react slightly differently to treatment, who also may have very specific biomarkers that can be used to identify them. And here actually we really started to have a need to identify these patients much more in detail. We use clinical features, biomarkers, and more also omics profiles, genomics profiles, or even multi-omics profiles. But also environmental factors played a role, because we realized that depending on the environment the patient is living in, his behavior or his response to treatment may be slightly different. And in some of the fields, that could even really be, scaled up into a field where we can target actually very small groups of patients, or even actually individual patients. And the number of biomarkers we use to do that may actually be very, very large. Now, very easy to understand is this, for example, in rare diseases, where a single mechanism or a single gene determines actually behavior of a patient. But more and more, we also learn that in complex diseases such as asthma, which is my field, for example, an entire network of genes and mechanisms actually influence the behavior of the disease entities and the specific strata of patients. And it's actually important really to understand these features much better. Now, in order to do this type of research, but ultimately also, to develop diagnostic methods that can identify subgroups of patients or individual patients, we need to take a slightly different approach. We need to have very well characterized clinical data. They can come from routine hospital data, but they can also come from registry data, cohort data. We do need biospecimen, very well-defined biospecimen, stored in an appropriate manner, also analyzed in an appropriate manner. And we have to have high-quality analytical platforms, and we are really in a fortunate situation in Switzerland that we have really, really extremely good technologies. But what we also realized that it's quite difficult sometimes to bring these clinical data together with these analytical platforms and actually to achieve interoperability between clinical data and analytical data. Many of these problems are related to technical standards, data exchange formats, quality standards, but also often we do not all speak of the same type of features or diagnosis, and we often have actually problems semantically to define what we really mean, and we need often to define a semantic interoperability. In order to do that, we need to have harmonized processes within Switzerland. We need to have a possibility to look for patients, to search patients, to identify patients of the same kind. But we also need to be able to search, data or by a specimen of the same kind. We need to make sure that we can transform them in a legally, ethically, and technically correct manner, and we need processes that really defines that. And at the beginning of this SPHN, we did not have that harmonized in Switzerland, but we made a lot of effort really to achieve that. The whole situation has actually also been quite complicated because the legal situation in Switzerland, the data protection issues in Switzerland, they are to some extent federal, and they needed to be harmonized in order to really also be able to perform multi-center studies. The same is actually true for the whole consent management and for the ethical framework, where since a few years we really already have some harmonization and processes that helps us. Nevertheless, we realized, that these issues are particularly important and also particularly difficult to overcome and to coordinate within a federalistic system as we have here in Switzerland. And the SPHN mandate actually really tries to bring these 5 pillars together and to have actually interoperability between these data. So the character of the SPHN initiative is not just, funding research, it's actually building up infrastructures that will allow in the future young researchers to deal with such big data and to be able in a facilitated manner to do these large-scale multi-center cohorts. Now, in order to achieve that, one of the biggest challenge, and I think we made a lot of progress in the last 2 years, is actually to bring all the stakeholders involved in this endeavor, to bring them together and to actually develop a common strategy where we would like to move. And we are extremely grateful that we have strong partners in Switzerland that were actually able and ready to align with SPHN. And I guess that was actually one of the biggest achievements of the last period. The second, I think, in my view, biggest achievement is actually that we learned from many of the projects what are the challenges, what are the gaps in Switzerland in order to move on. And I would like you to learn a little bit about this in this presentation. Now, we have, for the easy reader, made a little fact sheet that you see actually here. That is published on the website that actually gives you the current features, where do we stand in SPHN. But we also have a very detailed report, which is actually appearing at the SIMV in the beginning of the year, where you can basically read all what we're discussing here today in this presentation in full detail in a long report. Now let's start with capacity building. Capacity building basically is addressing different levels. One of the biggest challenges was actually the capacity building in university hospitals. The main topic of this is actually making clinical data shareable. So for that, actually, we had some legal frameworks, we had some consent management frameworks that needed to be addressed. And I think we made big steps in this direction, although it's still a challenge. What is probably even more difficult and we are still working on is actually that we have an interoperability of data, that we can compare data of different hospitals with each other that needed standards, to define certain things. We had developed a clinical research data management system where we were able actually to find data and to bring them together to identify data. And what we also wanted to achieve, and I think that's also due to a very good collaboration with the Swiss Biobanking platform, we wanted to have an interoperability with the biobanking samples so that we can identify patients, but we can also identify the biosamples that are related to this patient. We have built up a network, and I come to that a little bit later, and that's basically the achievement of many people from the Data Coordination Center that mainly is focusing on the interoperability, facilitating the findability and accessibility of data, to bring them together in one large biomed IT network, which is safe and which can actually be used for researchers to share data, to analyze data in a safe IT environment. But in order to do that, there were a lot of technical hurdles, and we had subgroups in the DCC dealing with the issue of semantic interoperability, biomed IT interoperability, IT security, hospital IT, and semantic interoperability framework. There were also issues of data identification, that this can be done in a safe way, that it can be done in a harmonized way within Switzerland. A metadata catalog, that makes it easier to find patient data, to find biospecimen, and most of all, and I will describe that in a minute, we built up a distributed federated query system where, based on metadata, patient of the same entity can be identified. That was only possible in close collaboration with our partners, and I would like to emphasize here SPP, the Swiss Biobanking platform, but as well, very important, the ETH domain with the DHRT initiative. We're really working extremely closely and in an absolute perfect manner with this consortium. We already talked a little bit about the process innovation, but I come to that in more detail later. Now, how is this DCC or Biomed IT network built in Switzerland? And please accept my apologies for just being a humble clinician and just giving you a sort of a rough picture of that. In Switzerland, we have already very good IT infrastructure nodes, as you see here on the scale on this slide in green. And we have the university hospital sites that are connected to these IT infrastructure nodes. So patient data, but also research data from universities and the hospitals can actually, if after de-identification, be connected to these Biomed IT network nodes. Now then, in the next step, these nodes, they are actually connected together, and this connection is actually organized by the Personalized Health Informatics Group, and basically consists then of this Biomed IT network, including these local clusters. As you see here, there are also local alliances that are connected to this network. For example, the Loop system in Zurich, Health 2030 in Lausanne, Geneva, and also Personalized Health Alliance Zurich and Basel, and a collaboration between Bern and Basel. Now, I think people really try on this network to connect together in a safe manner. Now, how do we how can we picture this data exchange? I mean, in clinics, that what you see on the left side, and also at university, there's a generation of routine data, omics data, cohort data, imaging data. They all undergo regulatory frameworks, consent, ethical approval, data transfer approval, and they can then actually be encrypted, and they can actually then be connected to this network. From a researcher's point of view, I would like to point out one very important issue, which you see at the upper end of this slide. The researcher can actually at any point in Switzerland access over a single access to this network, can actually deal with the data, and can then, and you see that in the lower part here, on this network, create his own compute environment, which is safe. Data can be stored there and can be analyzed there, and under conditions that adhere to the current national guidelines. Now, how actually do patient data go from, let's say, the hospital environment into a multi-center study that is performed on this network? Now, in principle, it's not very different from the current approach of multi-center studies, but we can actually now much easier see this data and plan a study. What you see here, there are 3 hospitals depicted, maybe then a research institution as well. And these hospitals, they have so-called data warehouses. And within these data warehouses, the data are still in the hospital environment, protected. Now, once a patient actually gives his or her consent, that data can be de-identified, they actually will find their way into this data warehouse. And they have typically a core data set with metadata that allows actually to have a distributed federated query within all the data warehouses. So in case you look for a specific patient group, let me take the example of childhood asthma. If I would like to know how many patients in hospital A, let's see, these are the red dots, are under 7 years and have the diagnosis of bronchial asthma, then I see here in this hospital 2,000 patients, in hospital B 2,000 patients, and in hospital C 1,000 patients. If I now plan a study, with this information, I can identify the patients. I can actually identify a large group of patients, a large cohort of patients, including access to availability of biosamples. I need to undergo ethics and data safety issues, data transfer agreements, but at least I can find with partners, I can actually design a study that actually involves more than just one hospital in a facilitated manner. Now, what's the current status of implementation? You see here on the left upper panel, you see here graphics, how many data are loaded from all of the 5 sites. You see the total patients on the y-axis, and on the x-axis you see the years, and see increasing. There are quite a lot of patients. There are already 350,000 patients actually with general consent available in this on such a network. As you see, also the data elements, they are widely distributed, including gender, age, diagnosis, job codes, LOINC codes in some of them. And you see here on the right upper panel, the distribution of age. So they are not only young adults, but there are also elderly patients up to 84, but even children are involved in that. And the distribution of gender is approximately 50%. I think there are data available that can actually be used for research, given a project that underwent the normal ethical and legal procedures. Now, where does this support structure go? The federated query system is actually now re-evaluated. this is led by the National Advisory Board, which is the technical group of the SPHN initiative, and the PHI, and subsequent improvements are actually planned. In Q1 of next year, the determination of access and use policy is actually established, and in Q2 we believe that the system could be accessible for researchers from other institutions. Now, the whole data semantic interoperability is actually quite complex, and please accept my apologies for being very basic here as a clinician, but you see the whole process of semantic interoperability is not that simple. It's not enough just to have clinical data, to have routine data or molecular data. You need to somehow make them understandable, for a search system. So the semantic representation of such data needs first to be built up, that we have a certain ontology, that we can understand what certain data mean. Then data need to be transported and stored, and then can, depending on the use case, made available on platforms on individual research process. But this whole process here is actually quite complex, complicated, and needs to be standardized within Switzerland. And I think these groups have made tremendous efforts in Switzerland with high competence to come to this point. Now, we need to very closely link to the basic science analytical platforms. And a dream would be, that as a researcher in Switzerland, we all would have easy access, standardized access to these genomics, for example, genomics analysis centers, proteomics analysis centers, independent where you are, that if you find your partners, that you can have access in a standardized way. And on the other side, researchers coming from basic science should also have, at any point in Switzerland, really have access to clinical data if they have partners on research projects. And I'm extremely grateful to have had a close collaboration with PHRT and SPP here in Switzerland. We talked about the processes, codes of conduct, harmonizing and adapting procedures and framework in Switzerland. And at the very beginning, we have started with an overarching ethical framework. How should we share data within Switzerland? What are the principles? You can actually find all of these guidelines and recommendations on the homepage of SPHN. Another very important document that has come out actually this year was the guidance on return of actionable clinical findings. What does that mean? It means if you, with a research project, by chance you find a gene that is now newly identified, to have a clinical implication, that may actually change treatment. How do you deal with such a finding? How can you feed this information back to the patient? Which is not so simple because data are de-identified, but this document actually addresses this issue. Another point that was very critical was actually to find legal agreements, data transfer and user agreements. We realized that this is still a difficult topic, and we will in the next funding period very much more work towards legal frameworks, so that it will be hopefully simpler for research consortia to actually design multi-center data-driven studies. The same is actually true for material transfer agreements, where we rely very much on the Swiss biobanking platform, who has done tremendous work here in establishing standards. The general consent was actually not a primary issue of SPHN. Here, with Swiss ethics and SM, we have worked a lot, but that was very important for SPHN. We also have defined the SPHN glossary. That means we have defined certain terms that we all speak of the same thing. We realize that communication within such a network is absolutely essential. On the technical side, we have talked about the WIMED IT network, but there's also an IT information security policy, a data semantic interoperability policy. We are now actually even go more in detail in a hospital IT strategy, and we talked about the distributed federated query system. We have to achieve that in the first funding period, we have actually chosen a combined approach with some funding from top down. One was, for example, the collaboration agreement to build up infrastructures within the hospitals. But we have also realized from the experience that in the real world, you need to have the experience and needs of the scientists. And we have done that in calls where we actually evaluated driver projects, which is a combination of research that help to develop infrastructures. So the outcomes are actually infrastructural goals, milestones, and we have also had calls on infrastructural development projects. And as you see here, we have built up quite a lot of these, but what is quite interesting to see in this graph of these 5 dimensions, all of these projects have had all of these dimensions. So basically all projects had bioinformatics issues, biomedical platform issues, network issues to connect patients, but all of them also had ethical, legal, security, patient information issues and patient or citizen related issues. That actually shows, you know, how complex this type of research is in the current clinical and translational research environment here in Switzerland. And nevertheless, we have made a mapping of these projects, and you see here on this table, which you also find in the detailed report, overall, we have actually been able to really build up 71 new infrastructures in Switzerland that are related to data-driven and personalized health research in Switzerland. We also try to assess, you know, how available are these infrastructures? Are they implemented already? And we actually came up with a scale reaching from 1, which is basically having a concept, to 2, having 1 clinical trial or 1 research trial dealing with this platform, or multiple trials, and 5, degree 5 would be that it's actually available for clinical decision making and clinical implementation. And you see on average, actually, these infrastructures have already quite a nice degree of average degree of implementation of 2.6. That means probably more than 1 trial is already, or 1 study is actually already working on this infrastructure. We would like to continue actually with this mapping, also showing you this to make it visible for you that you can use these infrastructures. And how do we do that? We have actually newly built an SPHN homepage, which hopefully will be in the next funding period even more fancy and more interactive. It should also involve actually teaching tools, because the whole research related to data-driven research is actually quite complex. On this homepage, and I would like to invite you really to go on this homepage, you will find all these documents, you will find projects that are running. You even may actually identify potentially interesting partners for your future research projects. And that's exactly what we would like to do. We would like to bring the research community together to show what is existing in Switzerland, to help you to link, but also to actually guide you through the channel of these regulatory and technical difficulties. And I would like just to give you one little example. When we analyzed all our research projects which we have funded in the last period, actually, and that's also in comparison a little bit to the international scene, we were actually able to categorize them in basically 8 categories. And I would just like to show you what it takes actually to perform a trial, for example, in category 1, which is was often done, you know, to identify molecular digital biomarkers or multi-dimensional signatures, actually, for example, to have a better risk prediction, better prevention, or better treatment. And just if you would like to design in the future such a trial, and you see how complex this is, you know, you need to go from the clinical problem to the multi-center study planning, to define a research project, to perform the study, and at the end to make data available. And we would like actually to guide you with such use cases through such projects. Where can you find your documents? What do you have to do? How can I learn from existing projects? How have they done it? Maybe how can I find additional clinical partners? How can I find additional partners in basic science? We also try to, you know, guide you through the legal aspects, through the ethics and IP issues, and we provide you with the documents so that your research is easier. We show you how you can actually find search data, how you can bring your data together, how you deal with the Biomed IT platform. And we also are quite closely linked also to our funders, where you can use many of the information here, for example, in the SNF to define your data, your data handling procedures. Now, data-driven research and personalized health research is only one aspect of clinical research or clinical translational research in Switzerland. And we always have to be extremely aware that this is only one dimension. And we have had a lot of thoughts together with other research networks in Switzerland, such as SCTO, SAKK, PHRT, SNF, and many other stakeholders, actually to somehow position this data-driven initiative, or SPHN, personalized health initiative, within the entire network. And very clearly, you know, SPHN, data-driven research, is often observational in nature and generates hypotheses. But I think that's only part of the problem. What we then need to do, we need to have research concepts where we do then hypothesis testing. And for that, we need trials, we need basic science studies that identify mechanisms. And we have to start to think a bit more broadly, you know, that SPHN, personalized health research, is not one thing per se, but it's always embedded in the entire network. And once we have actually tested the hypothesis, we then need to think about, you know, to implement this newly validated evidence. And after implementation, you know, we hopefully have better health care, but we also have normal health data that actually may actually feed back again into the beginning of this research circle. And I guess having a dynamic learning healthcare system in this way will actually drive not only research in Switzerland, but will also drive better healthcare in Switzerland. But in order to actually make this data available and interoperable, we need actually a vertical, that means from basic science to implementation in healthcare, and horizontal between hospitals and research center data flows and interoperability according to the FAIR principles. FAIR means, you know, they need to be findable, fast findable, accessible, interoperable, and reproducible. So data actually are the essence, the oil in the machine, and we need to make sure that these data flow. Now, in the first funding period, I think the most important thing in my view was actually we tried to analyze the gaps. What is missing? What do we have to do better? What should we do to become better in the next 4 years? And we have actually done an extremely distinct gap analysis. And I just show you a little overview, but if you're interested in that, please read the long report, which will come out in the next weeks. I mean, you see here we have worked a lot on general consent, ethical framework, semantics, data transfer, policies. E-consent is still outstanding. That's something that needs to be developed. in more detailed. We have some documents, we have some strategies, and you see here on we have a close monitoring actually, how much how much implementation has been done, how much do we still need to do. The same is actually true for services. We have had a few grants. We have done a lot of support in data interoperability, data query system, process innovations, and there are still certain things that are actually not fully solved and addressed. And if you look at these gaps here, we see that many of these gaps are actually relating to the interoperability between the university hospitals, which is probably very much likely also to be related to the local or regional standards of data interoperability. But that's a process that is important to solve in the next funding period in more detail, and we have made some efforts to do it. Now, how do we address these gaps? I mean, SPHN cannot command the individual players to do things, but we can actually try to address it in four manners. We have created scientific SPHN working groups, so we have brought the stakeholders together. This is particularly true for technical standards, where we actually brought working groups together to establish and work out national guidelines, national recommendations, and I'll show you in a minute what it is. We have also made a list of recommendations for university hospitals. We have spoken to their stakeholders, Unimed Suisse, university hospitals. We have made a list of recommendations for the universities, but we have also actually made a list of recommendations for the government and for politics. And let's just show you a short overview of that. We have reorganized SPHN, and I think that will be particularly important for the next funding period, where we have actually not only linked the management's office of the SPHN and the personalized health informatics group, which is linked to the SIB. We have actually now also together created a national advisory board, which is on a technical level, and this national advisory board is actually running certain task forces that address technical issues that are important for all of us. And I'll just give you a few examples. I mean, one of the task forces, for example, is actually developing a concept for patient and citizen involvement, a think tank, and we have coordinated that very closely with our partners. And for example, this task force is actually led by the patient organization and SCTO, but the outcome of this task force will be valuable and mandatory for all of us. We have a task force working on IP guidelines. This task force is led by the SPP. We have installed a task force developing guidelines for collaboration with the corporate world, with industry. That's actually led by SPHN LC group. We have a task force developing a concept for a Swiss Federated Genomics Network. That's actually also an SPHN group. Develop a concept for Swiss Federated Metabolomics and Proteomics Network, work group of data lifecycle management, and also a working group of harmonizing Swiss cohorts and data registries. I think important of these working groups are that it's a multi-stakeholder group that involves actually all of the research players here in Switzerland, and will actually come up with coordinated recommendations and efforts. The hospitals, interestingly enough, they had a certain heterogeneity. Some hospitals have developed personalized health and data-driven research infrastructure in quite a remarkable way. Others are still a little bit more at the beginning, but also within that, different hospitals had different priorities, and we have a certain heterogeneity with Switzerland. There's still some heterogeneity of patient data, of performance. There were issues, how research in hospitals are financed, how it's organized, how it's embedded with university partners, how are the legal and ethical support structures, and how are the data sharing and access policy, and how, one of the most important questions is how sustainable are these research structures within Switzerland. What we have done, we have really written a detailed report of the recommendations which we would like to the hospitals officials to do in the next 4 years, and we cannot do this on our own, but we have now a close collaboration with Unimed Suisse, because it's in their interest, and they're highly motivated with us to work on these issues, that these infrastructures are harmonized and interoperable within Switzerland. We also realized that in order to do that, the hospital IT leadership needs to somehow agree on certain standards, on certain procedures, and we have proposed, and Unimed Suisse has supported this idea, to have an overarching hospital IT strategy implementation group that really thinks about standards that should be the same in all the hospitals. For the universities and the ETH domain, I think it's mostly the issue of accessibility of platform, harmonization of cost structures, identification of interfaces with the hospital, and sustainability. On the legal side, there are also a few issues that needs to be addressed. One is, for example, there is a need for a patient ID for research that is de-identified, that is not speaking. Patients need to have an e-consent possibility, an e-signature, an electronic signature possibility to join a trial. And I think in the long scale, we must actually also think about some discussion, how data sharing in Switzerland should be done, and how much data protection we want, and I think these are important discussions. Now, where are we going in the future? What we realized is that in the next funding period, and we are very positive and have very strong signals that from 21 to 24, we will have approximately the same amount of money for further development. After that, the initiative will definitely stop. But we need to really focus on real world implementation and data availability. Data need to be findable, accessible, interoperable, and reproducible, so FAIR principles. And we also have to very, very much focus on sustainability. After 2024, we really have existing and self-maintaining and self-financing infrastructures that are actually then available for us researchers, but also for clinical purposes. SERI wants to have at the end a sustainable, independent national center for health and biomedical research data. That's not necessarily one central computer, but it's basically an interoperable network that actually will be like the final development of the DCC network, which we have at the moment. I think we need to very clearly and facilitate governance and access rule for external research projects. And we also would like to have to continue, and I think that's extremely important, collaboration with our partners. And we need to have trust building. Our partners are also funders like the SNSF and patient organizations. Now, the aims for the funding period you find here. What is in italics is optional, but I think we will definitely work also in this direction. So we would like to consolidate the existing infrastructure and prepare the network to include additional partners. We also would like to have more data in the multi-omics field and to expand the network with additional data sources such as cohorts, registries, and biobank. We also would like to make citizen data, health data interoperable so that they are searchable and comparable to hospital data. We definitely need to strengthen the SPHN ethical and legal framework. We need to foster the engagement with patient and citizen. We would like to have a strategy, and the working groups are already ongoing, for the engagement with the cooperative world and the international consortia, and as mentioned before, this long-term network for data exchange. We will have similar funding instruments. We show you in a minute how we slightly adapted these funding instruments, but there will be implementation projects, infrastructure development projects, and driver research projects. And we have one new option, national data streams, which I'll show you in a minute. Collaboration agreements with the hospital will ongo in the next 4 years to really make sure that this data can be shared. But we will here closely collaborate with Unimed Suisse, that our recommendations are also made implemented within the hospitals, and we would like even to target a monitoring together with Unimed Suisse that these efforts can be done. We have some remaining funds from the current funding period, and we have an agreement that we would like to invest that in a large fair data set of 100,000 patients that can be hosted or that can be searched through Biomed IT. It will help us, to understand the options, possibility, heterogeneity of data within Switzerland, feasibility of SPHN, and later in a phase 2, this data set can then also be made available actually for research projects that deal with individual research topics. We also would like to establish in this data set the possibility to identify biosamples available for research projects later in a second step. We also would like to have a new instrument, so-called data streams, which I'll show you in a minute. Infrastructure implementation projects and development projects and driver projects will be instruments that are coming as well. And we have reserved a little money for bridging funding because we know that that will be necessary. Now, actually, to address point 1 and 4 in a more sustainable way, we would like to focus on real-life implementation, sustainability, and also, facilitate the legal framework of these consortia. And in order to do that, we have actually this host fair data set, which I showed you. So 5 university hospitals will actually provide each 20,000 patient data sets, where we have actually the core data sets, data standards, qualifier, identifier, ethical and legal framework. They should be generally consented with third-party access, de-identified. They should be legally compliant data, and they should be able to be securely stored on the Biomed IT platform or in the hospitals with access to the Biomed IT platform. We would like to initially characterize them, and then in a second step, define future research projects. That can also be available for the PHRT and other research consortia. So the primary use of this data set is descriptive mainly. It actually will help us to improve data quality, will help us to understand the landscape in Switzerland, and the secondary use then are individual research projects or methods-driven projects. Here you see how we actually consider these steps. There will be hopefully a call in the next few months to collaborate on this host fair data set. The second new instrument that I would like to show you are the focus on national data streams. We realized from our projects, that there was an interest in actually even merging some of the driver projects in the first funding period, in that consortia, for example, of the oncologists, to building national platforms and data streams where future research projects can actually be hosted in a sustainable way. I think the motivation to do that is also international examples, and the motivation is also that we realize that consortia of stakeholders that have a common interest are often more efficient than smaller projects. And you can actually picture such a multi-omics national data stream in a way like this. You know, you have like a sustainable and safe biomed IT environment that is facilitated legal framework, clear governance access policy, where data can actually flow from the hospitals or even from the ambulatory setting into this data lake or in this data storage platform. And then embedded on this, you know, we can actually have driver project or even use Inspire project that actually deal with clinical implementation or clinical decision algorithms. So that's definitely one of the new forms we would like to have in the next funding period. We talked about this long-term international independent National Center for Health Data Coordination, which is a mandate from the SERI. And here we need to have a working group that defines technical platform, governance, access policy. It should be independent of a specific institution, but we would like to coordinate, particularly on a technical level, very closely with the ETH domain, and we need to work out until 2023 some options and scenario for the SERI to be decided how they would like to go and how they would want to make it sustainable. So in a nutshell, SPHN is a federated distributed network of interoperable resources. It's feasible within the Swiss federal legal system. It's sustainable, safe and ethical research legal environment, even with large data sets. We need to focus on sustainability in the next funding period. We would like to link it to analytical platforms and bioinformatics computational platforms. We have predefined processes and standards that now need to be better implemented. We would like to facilitate collaboration and uses of resources in Switzerland, and it's set up such that it's scalable to international and other partners, given on a project level that all the agreements are legally and ethically correct. I would like to thank you for your attention, and I'm open for questions.